Good morning, I'm Mabel Jong, and you're watching continuing coverage of the World Healthcare Congress in Washington, D.C. And I'm so pleased this morning to welcome Gregory Kile to the studio. He is Senior Vice President for Insurance and Payer Strategies at Lehigh Valley Health Network. Good morning.
Good morning to you.
Well, tell me a little bit about Lehigh.
Sure. Lehigh Valley Health Network is located just northwest of Philadelphia in Allentown, Pennsylvania. We have 5 hospital campuses within the network. Our medical staff is about 1,340 members, 700 of those are employed. We also have a very active physician hospital organization that's been operating now for the last 20 years as part of our physician alignment strategy, and recently made some additional investments in population health management tools and have rebranded a health plan management company that we've owned since 1988 to Populytics, which is a company that we're using now to do a lot of the data analytics for the work that we do around value-based reimbursement.
And I understand that Populytics will support the work you're going to be doing as a newly certified accountable care organization in the Medicare Shared Savings Program. So that's a really big project to take on. How will day-to-day life change for you at Lehigh?
Well, part of the implementation is merging the claims data with the clinical data. So we've had the good fortune again to have operated a full-service third-party administration company, a health plan management company. So the insurance competencies and the skill sets to provide that service have been with us for some time. The challenge, though, is not just the implementation and the merging the claims data, it's really the translation. So it's engaging our physician leadership, clinical leadership, to translate that data into actionable information that finds its way to our practices and our caregivers.
And what makes really reconciling all that information so complex? I mean, is it the different codings that come in to play and sort of all the different information that's coming from different areas, and you have to put it all in one place?
That's the big part of it. The technology is there. It's trying to take the information and simplify it in a way that it's crisp reporting to the providers. So we're pulling in information from our electronic health record, merging that with information from our analytic tools, taking that information, translating it, and providing that data in simple form as best we can to our providers and the population. That's a challenge.
Yes, and at the same time, you're trying to create more value-based care.
Correct.
So how is that going for you at Lehigh?
Well, the tool is the population health management tools and the merging of the clinical data with the claims data has put us in a better position to work more closely with the payer community who have an interest in doing shared savings or shared risk arrangements with us. We ask and receive claims data for their employees or their members who are attributed to our network, allowing us to run that through our tool, do the risk stratification, identify risk markers, and frankly do a better job of managing that population. What
is the message you want to leave with your audience today as they listen to your comments on the panel?
Well, it's obviously an interesting time. Clearly, these investments that a number of health systems are making are pretty complex and pretty expensive. But at the end of the day, from my view at least, if you're going to be held accountable, you need the necessary tools and information to be held accountable and provide the care that's necessary. So if you think about a number of the presentations that have occurred the last day and a half, most of which have been really focused around information technology and how do we get the claims data. Insurers are very willing to work with you and they have the technology, but what they don't have is the clinical data. So we believe having the clinical data, investing so that we can pull the claims data into our network will allow us better to manage the population.
All right, Greg, thank you so much for stopping by this
morning.
And I'm Mabel Jong. Thanks for watching.